Antidepressants sometimes come with side effects, including reduced libido and other sexual symptoms. Being on antidepressants doesn't have to mean giving up your sex life. However, if your medications are reducing your libido, talk to your doctor about your options. They may be able to adjust your dosage, supplement your medication, or switch you to a new medication that works better for you. If you have a sexual partner, talk to them about what you're going through so that you can work together on adjusting to the changes in your sex drive. So, we are going to watch about the how to increase libido while on antidepressants.
Method 1. Adjusting your dose.
First is make an appointment with your doctor to discuss your concerns. Before you make any changes to your medication routine, have a talk with your doctor or psychiatrist. They can inform you about your options and recommend safe ways to adjust your dosage. If needed, it can be difficult to open up to your doctor or psychiatrist about sexual side effects. Remember that you aren't alone. Many other people taking antidepressants deal with these same problems. Your doctor is there to help you in any way they can. Step 2. Find out if your medication is likely to be affecting your libido. While decreased sex drive or other sexual problems can be a side effect of many types of antidepressants, they can also be a complication of the depression itself. Some antidepressants are also more likely than others to interfere with your sex drive. Ask your doctor or psychiatrist how likely it is that your medication is causing your symptoms. The types of antidepressants most likely to cause sexual side effects include certain SSRIs, selective serotonin reuptake inhibitors, such as Prozac, fluoxetine, Paxil, paroxetine, Luvox, fluvoxamine, Celexa, citalopram, or Zoloft, sertraline. Some tricyclic antidepressants, such as tofranil, imipramine, and monoamine oxidase inhibitors, MAOIs, such as Nadal, phenelzine. Some types of antipsychotics, such as Haldol, haloperidol, Mellaril, thioridazine, or risperidone.
Step 3. Ask about lowering your dosage.
Decreasing your dosage can not only reduce your side effects, but it may also help you determine whether your low libido is actually caused by your medication. Talk to your doctor or psychiatrist about trying a lower dose of your medication to see if your libido increases. If you are taking an SSRI and experiencing sexual side effects, your doctor may recommend reducing your dose by half. Many people find that reducing their dose by half eliminates their side effects while still giving them antidepressant benefits. Before reducing your dose, your doctor may recommend waiting a few weeks to see if your side effects diminish or disappear. Sometimes it simply takes time for your body to adjust to the medication.
Step 4. Discuss taking a medication holiday.
Some people find that their sexual side effects improve if they take occasional brief breaks, 1 to 2 days, from their medication. This approach is more effective with some types of antidepressants than others. So ask your doctor if taking holidays from your antidepressant is likely to help you. This technique may work with some SSRIs, such as Zoloft, sertraline, or Paxil, paroxetine, but be ineffective with others, such as Prozac, fluoxetine. Ask your doctor how often and for how long you can safely take breaks from your medication. Step 5. Discuss raising your dose if your medication increases sex drive. While many types of antidepressants can cause sexual dysfunction, some may actually increase your sex drive. If your low libido is being caused by your depression or some other underlying condition, taking a higher dose of certain types of medication may be helpful. For example, Wellbutrin, Bupropion, and Deseril, Trazodone, can increase your sex drive. Talk to your doctor about whether it would be safe or beneficial for you to take a higher dose of your medication. Finally, adjust your dose only if your doctor recommends it. Never change your dose without consulting your doctor or psychiatrist first. Taking a dose that is too low or too high, or adjusting your dose too quickly, could be harmful to your health.
Method 2. Supplementing your medication.
First is ask about additional medications if other approaches don't work. The sexual side effects of antidepressants can sometimes be offset by supplementing with a second Medication. Talk to your doctor about whether this is a good option for you. Your doctor may wish to try other options, such as adjusting your dose or waiting for the side effects to diminish before starting you on an additional medication. Always talk to your doctor about the potential risks and benefits of any new medication, especially in combination with other medications you are already taking.
Step 2. Try supplementing your antidepressant with Wellbutrin.
Wellbutrin, bupropion, is an antidepressant in the NDRI, norepinephrine dopamine reuptake inhibitor, family. If you are on an SSRI that is reducing your sex drive, supplementing it with Wellbutrin may help. Some doctors recommend that patients on SSRIs take a low dose of Wellbutrin, e.g., 75 mg, 2 hours before having sex.
Finally, look into taking medications that treat sexual dysfunction.
Another option is to supplement your antidepressant with a medication specifically designed to increase sex drive or treat sexual dysfunction. Ask your doctor about getting a prescription for a medication such as Viagra, sildenafil, or Cialis, tadalafil. These are helpful if you are experiencing erectile dysfunction related to your antidepressants. Buspirone. This medication is primarily used to treat anxiety, but it is also helpful for treating reduced libido in women. Flibanserin. This medication, also known as the female Viagra, can increase sex drive in women.
Method 3. Changing your medication.
First is look into medications similar to your current one. If your sexual side effects are persistent and other approaches, such as adjusting your dose or supplementing your medication, aren't helping, it may be time to try a different medication. If your current medication is working well otherwise, it may help to switch to another medication in the same family of antidepressants. For example, some SSRIs, such as Lexapro, escitalopram, and Zoloft, sertraline, are less likely to cause side effects than others. If SSRIs work well for you, ask your doctor about switching to another SSRI that is usually better tolerated.
Step 2. Check into other types of antidepressants.
Some types of antidepressants have few or no sexual side effects. If you are unable to manage the sexual side effects from your current type of antidepressant, talk to your doctor or psychiatrist about alternatives. Antidepressants with low rates of sexual side effects include bupropion, Wellbutrin, nefazodone, Surzone, Vilazodone, Vibrad, vortioxetine, Trintellix.
Finally, ask your doctor about trying Street.
John's wort is an herbal supplement with antidepressant properties. Some people find it effective for treating mild depression, and it generally has fewer side effects than standard antidepressants. John's wort doesn't work for everyone, however, and studies on its effectiveness have yielded mixed results. Talk to your doctor about any other medications you are taking before you start using Street. John's wort. It may reduce the effectiveness of many medications, and can cause dangerous interactions when combined with other antidepressants. Check that your Street John's wort supplement has been reviewed by a third-party verifier, such as USP, NSF, or Consumer Lab. While Street John's wort is less likely to cause adverse effects than standard antidepressants, it may still cause sexual dysfunction in some people.
Method 4. Working with your partner. First is tell your partner about your symptoms.
If you're dealing with reduced sex drive as a result of your antidepressants, it's important to communicate with your partner about what you're experiencing. Talk to them about how changes in your sex drive might affect your relationship. If your reduced sex drive is creating friction between you and your partner, make sure that they understand that your mental health is a priority. Explore solutions that will help you both meet your sexual needs without compromising your well-being. Step 2. Plan to have sex before you take your daily antidepressant dose. Your sexual side effects may be most pronounced shortly after you take your medication. Let your partner know if your libido is highest at a particular time of day, e.g., an hour before you usually take your medication, and set aside that time for intimacy. You can also change the time when you take your medication if the current timing is inconvenient. For you and your partner. Step 3. Discuss ways to make sex more fulfilling and exciting. Sometimes spicing up your sex life is enough to counteract some of the sexual side effects of antidepressants. If you have trouble getting aroused or reaching orgasm, talk to your partner about doing things to make your sexual encounters more fun, exciting, and pleasurable for both of you. For example, you might ask your partner to spend more time on foreplay, use personal lubricants or warming gels, or incorporate sex toys into your intimate moments. You may even find ways to use your changed sex drive to your advantage. For example, some men find that delayed orgasm caused by antidepressants helps their sexual encounters last longer and, ultimately, be more enjoyable. Finally, get sex therapy with your partner if you need extra help. If you and your partner are finding your sexual side effects too difficult to deal with on your own, a professional therapist can help. Ask your doctor to recommend a sex therapist who has experience helping couples dealing with antidepressant-related sexual dysfunction. A sex therapist can help you and your partner communicate better about your needs and desires, offer strategies for improving your sex life, and help you cope with stress resulting from changes in your sexual routine.
Method 5. Enhancing your libido naturally. First is get enough sleep.
Getting enough sleep is vital to having a healthy sex drive. Studies show that sleep deprivation lowers testosterone, a hormone that helps regulate the sex drive in men. Lack of sleep also reduces sex drive and makes sex less satisfying for women. Most adults need at least 7 to 9 hours of sleep a night to be well rested. While some types of antidepressants may help you sleep better at night, others may cause insomnia or other sleep disturbances. Talk to your doctor or psychiatrist about your options if you feel that your antidepressant is making it harder to get a good night's sleep. Work on establishing a relaxing bedtime routine. Turn off all bright screens at least half an hour before bed, and unwind with a warm shower or some gentle stretches. Keep your room quiet, dark, and comfortable.
Step 2. Try stress-relieving activities.
While antidepressants can help reduce stress and boost your overall mood, you're still bound to get stressed out from time to time. Emotional and physical stress can lower your sex drive and make it harder to enjoy sexual experiences. Manage your stress with relaxing activities such as mindful meditation, yoga, relaxing hobbies, such as arts and crafts, gardening, or walking on nature trails. Spending quality time with family and friends. Listening to relaxing music, reading books or watching movies you enjoy.
Step 3. Stay physically active.
Working out can improve blood flow to your whole body, including your sexual organs, and promote the production of hormones that control your sex drive. Strength training can be especially beneficial. Try to do a little strength training 3 to 4 times a week for maximum benefits. Even if you don't have time to hit the gym regularly, try to find a few minutes to get yourself moving every day. Do an online search for short, simple strength training routines you can do at home. While staying active and getting exercise can benefit your sex drive, take care not to overdo it. High levels of intense endurance exercise can lower your libido, especially if you are a man.
Finally, eat libido-boosting foods.
There's some evidence that certain foods can improve your sexual health and increase your sex drive. Eating a healthy, varied diet will also improve your overall health and give you more energy for intimate moments. A few foods reputed to be good for the libido include strawberries, which are rich in antioxidants that improve circulation, avocados, which are full of vitamins and fats that promote good blood flow and heart health, almonds, which contain a variety of vitamins and minerals, including zinc, selenium, and vitamin E, that are linked to sexual and reproductive health. Zinc-rich foods, such as sesame seeds, oysters, and pumpkin seeds. Watermelon, which contains nutrients that relax and dilate the blood vessels. Dark chocolate, which is rich in antioxidants and natural mood boosters. Avoid eating meat and dairy that's treated with hormones since it could lower your libido.
We hope it is useful to you. Please subscribe to our channel to upskill yourself.